Good morning. My name is Romeo. I'm a student nurse practitioner. What's your name?
My name is Payal.
Okay, I'm gonna be recording this HEENT video for my school, United States University, so my teacher can, look at it and grade me. So are you giving me the consent to go ahead and record the video?
Yeah, sure.
Okay, so for this assignment, we will be doing head, eyes, ears, nose, throat, and the mouth. Okay. So
Okay.
first of all, I'm gonna be looking at the general symmetry of the head, starting from the head, looking at general symmetry, hair distribution, if there is any. Um, any bumps, any masses, any deviations. Have you ever had head trauma?
No.
No. Okay, so I'm gonna be inspecting your hairs first. There's no redness, no erythema, no masses, no bulging. Now I'm gonna palpate. No bumps, no cyst, no masses. Skull is evenly distributed. Okay. No palpable masses or cyst. Okay. Alright. So your head is asymmetric. Um, I mean symmetrical and normocephalic. Now we're gonna move on to the eyes. First of all, I'm gonna inspect your eyes. Okay.
Okay.
I'm gonna be looking at the cornea, I mean conjunctiva, just sclera. The iris is the outermost ring of the eye. Your eyelids, no ptosis, no ophthalmos noted. Lacrimal sac, there's no redness or a swelling noted on the lacrimal sac. The eyelids are evenly distributed in relation to the pupil, in relation to the eyeball. And now I'm going to look at your eyes. Conjunctiva is clear and the sclera is white. If it's pale yellow, then it's an indication of jaundice. So now your eyelids are evenly distributed. Your hairs of the eyebrows are evenly distributed and they are symmetrical. Okay. And now I'm gonna be looking at using the Snellen's chart to check for your visual acuity. Okay. So at a distance of 6 feet almost, this is called a pocket Snellen chart. I'm gonna have you cover one eye and read the bottom line.
LTFPH.
Okay, cover your other eye. All right, read
LTFPH.
Okay, with both eyes.
LTFPH.
Okay, so your vision is 20/20. The top number indicate the distance at which the patient reads the chart, and the bottom number is the number at which the normal eye would read. So your vision is 20/20. Okay,
Alright.
and now I'm gonna be moving on to your reactions. Okay, the pupillary reactions to the light. So I'm gonna be looking into your right pupil, 3 mm constricting to 2 mm, left 3 mm constricting to 2 mm. This is a direct reaction of the line, and now I'm going to check the consensual. Okay. Consensual is if I'm putting the light on your right ear, the left pupil will constrict. Okay, the left is constricting, putting the light on the left, and the right one is constricting. That is a consensual. Okay, now we will be checking for the convergence and the accommodation. Okay, move your eyes, follow your eyes. Okay, so my eyes are moving inward. Okay, that's conversion. And accommodation is look at the pen, look at the wall, look at the pen again, look at the wall again. Okay, that is convergence and accommodation. Okay, now we're going to be checking your extraocular movement and the muscle strength. Okay, so you're going to follow this line. Don't move your head. Okay, to the right, up, down, to the left, up, down. This is extraocular movement. And this is to check your 3 nerves: cranial number 3 oculomotor, cranial number 4 trochlear, and cranial number 6 abducens. So all these 3 cranial nerves are intact. Okay. All right. Now I'm gonna use the ophthalmoscope, to look into your eyes. Okay, we'll be checking for the cornea. If there's any opaqueness, that is an indication of cataract or glaucoma. And I'm gonna be checking red reflex, cup to disc ratio. The diopter is at 0. I see the circular. Okay, so I'm going to be using the right eye. The lights are dim. Right eye with the right hand. I see the red reflex holding your hand. Okay, there's no cotton wool like spots. The cup to optic ratio is 1:3. Cornea is clear and no erythema, no redness noted. Okay, no unusual dryness from your eyes either. Now I'm going to be checking the left. See the red reflex. Sorry. Okay, the cornea cup to disc ratio is 1:3. No corneal abrasion, no lesions, no drainage, and now we inspected the vessels also. Okay, now we're gonna move on to your ears. No, actually nose. First I will do the nose. Okay, the nose. While I'm inspecting the nose, I'm looking for the symmetry of the nose. I'm gonna be looking at the symmetry of your nose. The nose is symmetrical. There's no septal deviation. Septum is midline.
Okay.
And I'm gonna look inside to see the turbinates. Mucous membranes are pink. Turbinates intact. No drainage, no redness. Now I'm gonna have you close your eyes.
Okay.
Actually, before do that, I can check your patency. Close your one nostril and take a deep breath, and then close your other nose and take a deep breath. Okay, so that is check the patency. Now I'm gonna have you close your eyes, and we will check the olfactory nerve number 1. Okay? Olfactory nerve, sorry. Okay. Do you smell something?
Yes.
What do you smell?
It's coffee.
Okay, alrighty. Keep your eyes closed. Now I'm gonna have another stuff for you, and you will tell me what do you smell.
This is a lemon.
Lemon. Yes. So that is to check the olfactory nerve. Okay.
Right.
Number 1. Alright. So that is the nose, and now we're gonna move on to the ears. Okay. I'm gonna be checking your auricles. The ears are symmetrical. The auricles. No exudate, no redness, no drainage on the external ear. And I'm going to be tug test. Do you feel any pain?
No.
No, on this side.
No.
Okay. Now I'm going to be checking your internal canal. Alright, checking the right eye. Right ear. Okay, ear canal is clean and dry. Mucous membranes, the membranes inside are no redness on the membrane. The tympanic membrane is pearly gray, and the cone of light is angle of 5. And then I'm going to do the same thing on the left. Ear canal is clean. Tympanic membrane is pearly gray, intact. No drainage, no exudate. And cone of light at 7. Okay. Right. Now I'm gonna do the wiggle test. Okay. The wiggle test is to check the visual acuity on the lateral side. Okay. You're gonna tell me when you see my fingers. Okay.
All right.
All right. Cover your one eye. Just close it. Just close.
Okay.
Yeah. And then tell me. Okay. Open the other eye. Cover one. Open the other. And tell me when you see.
I can see.
Okay, close the other eye.
I can see.
Okay, now we're gonna check with both eyes. Tell me when you see, and almost on the lateral side 2 feet.
I can see.
Okay.
Yes, I can see. I can see.
Okay, so you should be see both hands equally at the same
Yeah.
time. Now we will be doing a whisper test. Okay, I'm gonna have you turn and close your one ear right here, and then I'm gonna say a 3-syllable word.
All right. 5, 4, 3.
Okay, do the same thing on the other side. Close this ear. Let's say 3, 2, 1.
3, 2, 1.
Okay, so that is to check the your acuity. Now I'm gonna do a Weber and the Rhines test. Weber and Rhine test is if you know that somebody has a hearing impairment. This is to check if you can the differentiate between the sensorial hear loss and the conductive hear loss. Okay, so first of all I'm gonna use the Weber's test. I'm gonna set the tuning fork to the vibration and put it in the middle of your forehead. Okay, and you should be equally able to hear in both ears. Alrighty.
I can hear both ears.
Both ears.
Yes.
Okay, alright, now we will be doing the Rhines test. The mastoid bone.
Yes, I can hear.
Tell me when you don't hear it anymore.
Okay.
Do you still hear it?
Not anymore.
Okay. How about-
Yes, I hear it.
Okay, alright. The same thing on this side.
I can hear it.
Tell me when you don't hear it anymore. Still hear it?
No, no anymore.
Okay, how about now?
Yes, I can.
Okay, so the air conduction is more than bone conduction. There is no hearing loss. Alrighty.
Okay.
Now we're gonna move on to the mouth. Alright, so for the mouth, we will be inspecting your lips first of all, okay? There's no chapped lips, no dryness on the lips, no ulcers, no sores. Okay, and then I'm gonna be looking at your internal oral buccal mucosa. Open your mouth for me. Okay, so there are no gingivitis, no dental caries. The tongue is midline and no erythema, no white patches, no nodules or no deviations noted on the tongue. The tonsillar area is intact. There's no redness, no exudate noted on the tonsillar area. And when she said I was able to see the uvula. That is to check the cranial nerve number 9 and 10. That is glossopharyngeal and vagus nerve. So now we will be checking the strength of your tongue. Okay, I'm gonna have you put on the other side. Alrighty, so that is to check the hypoglossal nerve, the strength of the tongue and the hypoglossal nerve, and that is intact. And now I'm gonna ask you to check the cranial nerve number 7. That's the facial nerve. I'm gonna ask you to puff your mouth. Okay, and then smile. Okay, that is to check the facial nerve. And after that I'm gonna be moving on to, so there is the mouth is intact, the tongue is midline, no drainage, no exudate, no white patches, no tonsillar area abnormalities like no exudate on the tonsillar area, no redness noted on the mouth, no any indentations or no ulcers noted in the oral mucosa. Okay, and tongue is symmetrical. And now we're gonna move on to the range of motions, to check the neck. Okay, so flex, hyperextend, lateral, the other side, and circular. Okay, now we will be checking the shrug test. Okay, the shrug test, I'm going to put a resistance. Okay, good. Alrighty, now I'm going to have you turn your face and then you're going to move it against the resistance. Okay, alright, and same thing on this side. Hold on, this. Alrighty, so that's good. Alrighty, now I will be checking your neck, actually the thyroid gland. Okay, thyroid gland, we will start from the chin area moving downward. The first hard spot you feel is the thyroid cartilage, and then we move fingers down. This is the cricoid cartilage, and if you move a little bit downward, that is the rings of the trachea, 2 rings of the trachea, and then onto the sides we feel for the thyroid glands. Okay, have swallow for me. Alrighty, I see the one movement on the one hand more than the fingers of one hand more than the other, and we use the fingers to like palpate the thyroid gland. Now I'm gonna be using checking for your lymph nodes. Okay, because there is different kind of lymph node. We'll be checking for any tenderness or any pain when I'm palpating the lymph nodes. Okay, so first I will start from the preauricular. Let me know if you feel any pain, okay, or any tenderness. And then I'm going to be checking post-auricular, okay, then submental, submandibular. Do you feel any tenderness, any
No.
pain? Okay, then we're going to go to the anterior cervical. Any pain?
No.
Then posterior cervical. Any pain?
No.
No. Then we'll be checking the supraclavicular. Any pain or tenderness?
No.
And then we will be checking for the occipital. Any pain or tenderness?
No.
Okay. Alrighty. Thank you so much. Do you have any questions for me?
No. Thank
Alright,
you.
thank you.